podcast about the game of life and the hero's journey we all experience. Let's jump in with our host, Dylan Watkins, as he introduces today's guest.
Are you interested in medical virtual reality, using virtual reality for good and to help humanity? Well, on today's podcast, I have the president of Grassroots Developer Education and MedVR, Stephen Max Patterson. He is the producer of the technical competitions and hackathons of extreme scale focused on discovering the applications of new technologies, innovations, and mining new ideas in the fields of augmented reality, virtual reality, machine learning, and quantum computing. He is best known as the producer of the Reality Virtually Hackathons at MIT Media Labs and creating the Reality Hackathons at the University of Southern California. His newest project, MedVR Symposium and Hackathons for AR, VR, and Healthcare, which is scheduled for coming up, and he is at the Northeastern University College of Art, Medicine, and Design. Hopefully I got that right, Stephen. Without any delay, Stephen Max Patterson.
You do. Yeah. Hey, thank you for the introduction.
as a guy going through things, I'm like, I hope I'm saying this right. I don't know, but I'm gonna keep going. So, yeah, man,
sounds good. Yeah,
I'm stoked, man. Like, I'm actually really stoked to wrap with you. You know, we always kind of like connect at conferences or events, or me and you have put on hackathons, and so we generally at these people gatherings, and it was so nice to get with you post pandemic at the AW conference and catch up with you and hear what you're up to, and I loved all the things that you got going on right now. So I'm excited to wrap with you, brother.
Oh, well, thank you. Likewise. You know, we've been heads down, reconnecting with everyone now that the pandemic may have slowed, and then we've got more opportunities and more flexibility to create an XR in medical education program without having to commit that the entire educational experience is going to be on Zoom. You know, I mean, I think we've all had enough of it, and I actually think, you know, from my experience, to do as good a job as in person on a platform like Zoom costs more to develop than to do it in person. There's just so many things that need to be done to sustain engagement.
You're saying it's easier to try to create an in-person event because you're kind of like locked into place, and it makes it, you know, versus people can zone out on Zoom,
Yeah,
and be able to go through. You know, it reminds me of doing the MIT hackathon in January in Boston, and when you talk about being locked into a place, I remember, like, you know, we had these lunch breaks there, right? And you were like, oh, let's have lunch. I was like, great. And I'm like, you know what, guys? I see there's like a little cafe around the corner. I'm just gonna go for a quick little jaunt to that cafe. And Boston in January, I went to go walk outside and just snowstorm hit with the things. I'm like, it's like a quarter mile that way. And I'm like, this is terrible, is it? And I'm like, I'm gonna go run back inside this building where I'm warm and safe, and I'll eat this pizza and do all that stuff, because you really are. You're locked down. You're not going anywhere. So
that was a good event. It's got tough numbers to beat. We had 460 participants attending. We had the head of new technology for IDEO running the mentors there, and we had 100 project submissions, which is pretty large, for sure.
I remember trying to just like handle the madness of, like, I know I was doing, like, not only was I doing some judging, but I also had to curate. Like, there was so much judging that had to happen that you couldn't see it. Like, you go around all these places. I mean, I drew arrows with sticky tapes to get around that place, because they're like everywhere you went, there was like XR developers building something downstairs, across the street, up around the corner, in a cupboard somewhere around the corner. There's just like hundreds and hundreds of developers building just cool, innovative stuff, which I thought was super. It's definitely gonna have your work cut out for you. Are you looking to do, like, since we can now get back together and meet space? Are you looking to do another in-person content creation hackathon thing, or is it something? Have you shifted methodologies?
I definitely shifted methodology, and I think it will be a hybrid program. We're building both an incubator for medical XR, and we're also creating a boot camp that will take people from tech and healthcare, merge them together, and fill in the gaps of both groups of people. The healthcare people, will learn how projects are run, how technical projects are run. I shouldn't cut them short. And also what their role is in on an interdisciplinary team that's going to build a prototype product. And the tech people need to learn a lot about healthcare, but my interest is educating technical people on what's different, because I think a lot of technical people avoid healthcare because they don't understand the language, and they don't understand the monolithic aspects of it. People, if you don't count the technical part of the program, the important things that they've got to understand is privacy, HIPAA. They need to understand ethics. Anytime you do an experiment with patients, you need to fill out an IBR and get the institution to prove it that it's ethical. So that I think is important, and it's also important to be able to talk to people in healthcare, to talk to patients. So that's what we've cut out for ourselves on the boot camp side. And we'll get the first cohort in I think in the fourth quarter of this year started. Nice. And while we are out raising money and building partnerships.
I love it. So when you're talking about the first cohort, this is a cohort that's going to be a part of the university, or do they apply to be a part of it? If there are people that are interested that want to be a part of this fourth quarter cohort, like, what do they do to sign up to be a part of what you're talking about?
Yeah, there'll be applications and to join it. I'm hoping I can raise enough money so that the boot camp doesn't have a tuition, so that people from all walks can participate. Because like the Media Lab, we wanted to get the best possible people there, and we paid out travel funding so that people could travel, and I think we're going to, as much as possible, do that with MedVR.
That's awesome. Yeah, I mean, it does open up a lot of. There is a lot of barriers for people to try to develop on this cutting edge technology. One of them being funding. Other one is like locations and distance. Can you get the right people in the right room, and working on the problem? And what I like about it, what you're talking about, is that there's a kind of especially with these like content creation weekends, hackathons as we know them, is that a lot of people just build on the technology because the technology is cool, right? But after me and you've done a bunch of these hackathons, it's like, how are you actually building a product? How are you actually solving a problem? What does that actually look like? And and it's very difficult. You can't be a master of all these different things. You can't be a master of programming and be a cardiologist. I mean, maybe you could, but the chances are that it's way better to kind of get this interdisciplinary skill sets together to work on to solve a problem. As when you're talking about a prototype product, to kind of get them out the door. The challenges, what you're talking about, this is the barrier about one being funding. What are some of the other barriers of trying to get this magic pot of people stewing together? Like, what are some of the challenges that people face as you're trying to make this thing happen?
Well, I think, you know, we've got a lot of work to do in every area, but it's going to be about a 90-day boot camp. You know, the unfortunate thing about XR is you can't really build a product or even a good prototype in 5 days, which was pretty obvious at the Media Lab, because having analyzed all the teams and looked them up, only one became a company. That's out of 300 projects, 300 teams, which I don't think is a good enough return on the effort to run it. So what we're really focused on is getting people prepared to build a solid prototype, and to give them the resources, the domain experts to guide them. So we have a partnership with Boston Children's Hospital, a partnership with in development with Mass General, Brigham, as well as the University Hospital Heidelberg, and the Technical University of Munich, as well as Johns Hopkins, where we can draw on expertise to first vet the projects that people are going to engage in, and once green lighted, can be there to provide the domain expertise, so that they essentially become the lead user for the team.
Mm-hmm.
But you know, I do, to be clear, effectively using the scientists and doctors in these organizations is tantamount. We won't get them to actually commit to boot camp because they just, you know, won't have the time. They won't be able to take the time. But working with Nasir Nawab from Technical University of Munich, I understand how they can, the clinicians and the scientists' time can be organized to be effective, and that's the most important part. What was missing in those 300 projects was typically a lead user who knew their application cold.
Yeah. It's someone that had a problem, or someone who actually goes through it on a daily basis that's trying to solve it another way, right? Like if you're making a note-taking app, for example, you know, you got to work with a person who's using the pen and paper, right? And then you got to figure out how do I actually, because otherwise it's all theory based, right? And so I think you're totally right on that point. And you don't need them the entire time. You just need them to call BS on whatever they see, right? They're like, yeah, there's no way to ever use it, because one of the biggest challenges, one of the biggest roadblocks, I think, that I feel like a lot of developers, let's say someone has a wild idea to build an amazing AR or XR application for the medical space, is the fact that the biggest barrier they have is the lack of adoption that medical professionals will have to your technology. Like, will they actually use it? They're busy, they're trying to save lives, they're trying to actually make things happen. But you're trying to introduce a product that has no actual feedback from the end user, then they're gonna hit that wall, right? They're gonna be like, oh crap. And usually by the time they get to the point where they actually build that product and they show it off for the first time, they've already invested months or years or hundreds of thousands of dollars, and then they have to start the iterative process. And so what you're doing is you're jump starting it in the very beginning. So instead of them building a skyscraper, tearing down the skyscraper to build it back up, you're saying, hey, might as well build it right from the beginning, right? That kind of the thought process there.
Yeah. And Nasir Nawab, who's professor at the Technical University of Munich, has been doing this for 30 years. And the engagement with the experts, and how you get to them and how you work with them is really, really key. But I have supporting clinicians like David Hoganson, who both has a cardiac surgery innovation lab at Boston Children's, and he also is a practicing surgeon. And when he shows up, I'm very respectful, because I know that his time working on this is coming out of his sleep budget.
Yeah, there's not a lot of sleep that goes on in the whole hospital space too often, man. They definitely know how to grind, which is impressive.
He's worked on a project. One of the interesting things that has changed, or he's changing, is running simulations of an actual patient's heart, before and after, and contrasting different approaches to repair the heart, so that before he goes into the operating room, he's got a pretty good idea of what the procedure is going to be, based upon the simulation. And that I think is really useful, because the way it's been done is the cardiac surgeons had the radiology and the CAT scans, but they really decided exactly how they were going to do it when the child was being operated on. And I think this gives greater certainty of the choice.
Yeah, it allows you to. I mean, like, humans are prediction machines, right? We're constantly predicting what's going to happen, when, where, and why. And what you're saying about that, which I think is a really good use case, is the fact that you can actually see the heart of the patient beforehand. So you can, instead of making predictions on the fly, you can kind of roadmap it ahead of time and be able to actually see it and know it by going through the process ahead of time. Now, this application that you're talking about, is this XR, or is this computer simulation that's done on a PC?
It's VR.
It's VR.
It's VR. It'll also run in a cave, as well. It's the team that built it is at the French engineering company, Dassault.
Got it.
And go ahead.
And just so anybody is curious about, when Steven says the cave, what he's talking about is, imagine being inside of a small cubicle kind of room that has projector screens all around you, that is operating almost kind of like a holodeck environment. So it's like a VR headset without the headset, but you're inside an environment where there's projector screens all around you that are reacting to the position of your head and your body. And that's the kind of a way that's kind of was before you could get VR headsets working super functional, super cheap. There's the cave system that operates still today as a functional, immersive application or hardware system, right? Something like that.
Yeah. There are a few caves around Boston that I've come across, but Amgen uses them for drug discovery discussions, where they'll put up a molecule or a synthesis in their room, in their VR room, and get to see it in much larger than life size.
Yeah.
So
It's a great use case. I mean, on that note, you're very, let's say, bullish in the area of medical and VR, and I think you've been a part of a bunch of hackathons. I mean, you've been a part of a bunch of hackathons that I've been a part of, right? And you've narrowed down and focused on medical XR technologies as the main area that you want to kind of help facilitate the next generation of entrepreneurs and people that want to actually go from actual idea to functional prototype into a real business, right? Can you answer me, like, what about the medical XR area for you? Why do you put so much energy in that space? What about it, is the thing that causes you to put in so much of a driving force to make real businesses out of that space?
Well, I did a fair amount of research, and I got to know different sectors in the industry pretty well, and I thought one of the areas that I was going to focus on was gaming and entertainment. But what I found there is that most of the big studios understand how to solve the problem already, and they have people in-house that understand it and can work with the technology. Disney has engineers, for instance, but they're not about to turn around and put an enormous effort into growing that part of their business yet. When you look at the economics of building a game for a headset versus building a game for a console, the economics are completely different, and they're in a wait and see mode. And when they step into the water, they're going to be very, very well prepared, and they'll start to invest large amounts of money in acquisitions and their own engineering teams. So, finding that was a wait and see. I happened to go down to the virtual medicine conference at Cedars-Sinai in LA, and that was a wonderful experience. For me, the two docs that run it really brought in a good crew of speakers, more focused on the research side. But what was clear was that the evidence-based discipline of healthcare leads to collecting good data that will produce a good problem statement set that'll let you build a product with much different economics than the economics of gaming and entertainment. There are so many different uses that we're seeing, ranging from pain management to well-being, which is an interesting area. Surgical training, surgical augmentation, surgical planning. There's just a really long list. And when it comes to the training aspect, it's a field that is constantly upgrading itself. You have to get continuing education credits, and this is a wonderful way to give people both the education upgrade, the educational credits, as well as provide them a very, very tangible experience of what it's like to work with technology.
That makes a lot of sense. I mean, there's a bunch of use cases. So what it sounds like you're saying is the entertainment space right now is something that isn't in, while it is a space and there is a lot of money being generated in it, it's not nearly as painful as a problem and an underserved population as much as the medical side for the XR technologies. And so because of that, there's a population that needs it in the medical space that's not being served, that is very difficult to get right. But if you get it right, there's huge opportunities for solving real problems, whether it's the training side or just facilitating a whole host of problems that you can solve, like the pain management, wellness, or any of those other types of things. One of them being, which I thought was crazy, is that they've used it for childbirth, for pain management and childbirth. Could you imagine that? It's like, well, we could give you an epidural in your neck and just completely numb it down, or you can put this VR headset on. I mean, I'm a VR advocate as much as anybody, but man, could you imagine that choice? But apparently it does actually reduce the pain quite a bit, and actually turns off like receptors or something that's going on through the spine. There is something there that happens. Now, I can't speak 100% to it, but I'm amazed constantly finding out these new novel use cases for virtual reality in the health space. Are there ones that you've seen that are like that make you kind of turn your head sideways and go, oh wow, that's interesting. I wasn't expecting VR to be used for that case.
Well, you know, there's a bunch of different areas for innovation, but one of the ones that's really interesting is what they call bedside procedures, where you the doctor performs the procedure in the patient's room, not an operating room, and is performing the procedure on essentially 2D radiology, 2D imaging, and things like having to insert a catheter drain into someone's brain to draw off excess fluid is done exactly like that. The technology is almost there. It needs to get just a little bit more accurate, but there have been applications built that overlay the patient's true anatomy onto that part of their body, in this case a skull, so that the doctor, as they proceed, can see all the landmarks that they're trying to interpolate, that they were trying to interpolate formally from the 2D X-ray onto the person's head. And there's been trials that are pretty positive. There's another there's another where, and this is actually a company, I just forget their name for the time being, but a cardiac interventionist oftentimes needs to catheterize, use a catheter to go into the patient's heart, because they have a secondary nerve bundle that conflicts with the nerve bundle called the sinoatrial node that keeps your heart beating accurately. And when these two things compete, it causes fibrillation. And a lot of times it's a cause when you see young people that died of a heart attack. So the solution is to up through the arteries into the heart and ablate, meaning putting a cathode and an anode on the excess bundle and burn it out to help the patient. That's also done with reference to 2D imaging, on and off, and it what this project does is it creates a hologram of the actual patient's heart, and the interventionist can see the catheter go up into the exact place in the heart. And what they found was that they were 3 times more accurate, and they destroyed less healthy tissue in the patient's heart.
Wow.
So that's kind of
it's crazy. It also makes me very like queasy to think about like catheters going inside hearts and going inside the brain and stuff like that. That's a really, I mean, you want to talk about the level of pressure that someone's under to try to get that right, and the education being is just typical 2D fashion done on a PC, right? I mean, that is a great use case for VR. It makes me think that Confucius quote, I hear and I forget, I see and I remember, I do and I understand. And that's like one of the best things about that is that they're actually doing the process, because you want someone to really clock that in and get that right. But I mean, I think all humans are going to be under pressure to do that, to get it right. But you really want to be able to have some wiggle room to not, ruin someone's heart with shaky hands and going through that whole process. So that's really incredible. And I'd be curious about the effectiveness on terms of, you're talking about the training effectiveness. Like, I mean, I'm sure there's some sort of equation of like how many lives can be saved. If training on that goes up, there's a typical failure rate of X, Y, and Z. If training is this much more efficient, that this is how many lives we're saving. I'd be very curious on that kind of metric. What that could be.
There's a team out of the University of Maryland, doctor, clinician, Sarah Murty, and she's been charting all the risk areas, and prioritizing them, and bedside procedures are one of the things that she's really focused on. The risks to someone in an operating suite are much less than these bedside procedures. So it's a fascinating area.
Yeah. So then, right now what you're looking at to do is you're looking to you're raising funds right now so that you can create this program to be able to drive aspiring developers and entrepreneurs and people together in a cohort to kind of bring them through a system, a training program that you have to kind of actually help facilitate productive, actual practical prototypes that can be applied in the medical space, and then help them, go from prototype to actual full business. Is that the holy grail, or what is your holy grail that you're seeking to achieve by raising the funds and going through this whole program?
Well, we've been really good at getting people jobs in the XR industry by giving them the experience. We want to do that, but more so we want to produce products so each team in the boot camp needs to build a prototype, and that's the key part to getting certified. They need the experience of deciding what area they want to move into, working on an interdisciplinary team, interacting with medical people, and then producing something that medical people would say that looks useful.
I might actually use it. Yeah.
That's a hard part. Is getting something that people want to use. I don't think that each cohort will produce 50 products, but I think having the accelerator for both the most capable graduates of the boot camp to bring people from outside that already have teams and have an idea that's been vetted by by our partners at Children's and at the other hospitals.
Yeah. So then really what's about is producing products that are actually valuable and usable, and saying, okay, and it's like the Y Combinator kind of thing. Y Combinator is not trying to knock everyone to be successful that goes through their doors. It's about, hey, this is a numbers game, but you're going to get the methodology right, and there's going to be a certain percentage that there's going to be a couple home run hits that are going to come from the program, which really touched on what I think you touched on it already, but I do want to ask it because it's a part of the sequence here. Is the Holy Grail is to actually produce valuable products that people use in the medical space, right? And so what is the biggest, what I would call dragon, that's preventing that from happening? What do you think is the biggest challenge that you're going to face by trying to actually make this Holy Grail happen?
I think it is the applied aspect of the training. We'll have a very interdisciplinary cohort, but we're not looking to produce the entire cohort of we want to produce people who understand what it's like to work in a hospital environment, or work in a medical environment, build a product, get feedback, iterate it. If it requires approval, to get it approved, and produce it. That's really the important thing. And again, the wonderful situation that we're in is we have some of the largest hospitals in the world that are interested in this program. So they, to give you an example of why they want to be ready and participate, the head of the Stratus simulation division at Mass General Brigham said, and they have all very physical types of simulation to train people. They have $80,000 dummies that they use, and Roger Diaz, who heads it, said, in 5 years, 50% of what we're doing now manually will be in XR, and he said in 10 years, 90% will be there, and we have they're really motivated to see what can be built and what's being built to prepare for it. And that asset of being able to engage the experts in picking and refining projects is really critical.
Yeah, it's like what was done 10 years ago versus on the web versus now, right? There's this massive adoption. Before, there was the telemedicine wasn't really a thing, so many years ago, and now it's getting more and more common. The XR adoption rate, with how many headsets and how quickly the adoption rate is happening now, I could absolutely see that, everything's going to be shifted there. It's just about making that infrastructural setup, right? Making the applications that actually work, that are practical enough that people, it's like, this is good enough, like when the Oculus Quest 2 came out, it was one of those times that was like, oh, this is finally good enough for people to kind of get up and use, and it can get the job done, right? And now that that's opened the doorway, there's so many other competitors that are right behind it that are kind of in that same vein, that are able to do this kind of inside out tracking and lightweight headsets, and there's all these like peripheral devices that are satisfying needs, fleet management tools for the for the XR industry. So I absolutely see the adoption happening very quickly, especially as like more of these problems get solved. But we're still in the early days, right? This is still very early days of XR technology in the medical space, and so there's a whole bunch of opportunities for young startups in the space. I actually, know me, Stephen. I coach other XR developers and stuff, and there's actually one of the guys that I coach who's actually working on a medical therapy tool, who I might introduce you guys in for Q4 and see if he's a good fit for what you guys are doing. But I don't know. I was going to ask you on this space right now. What advice would you give to young XR professionals that want to get into the medical space? You know, that are, say, interested in your program, but they want to get started now. They want to get up and going. What advice would you give to them to kind of start to work their way into this industry?
Yeah, you know, I think the ideal job is one where they're hired for their technical skill by someone who is equivalently skilled in healthcare and medicine, and to work on a project with that person. I think that, you know, I think you'll find that as busy as clinicians are, they'll make time for working with someone if they think there's a solution there that will help improve the condition of patients. So I would also say that getting in anywhere in healthcare, so they start to understand the language, is an important aspect, and it might not be the perfect assignment, but it's a way to get started. Mm-hmm. The other thing I would take a look at is there are lots of research papers that are published every single year, and finding projects in published research that they could contribute to, and then finding that team that did the research and see if it's an employment opportunity or a partnership opportunity. You know, if a paper on 3D imaging has had 600 citations, that team's pretty good. And also finding the innovation teams in the big hospitals, and expressing an interest in working with teams that are on engaged in research, preparing to publish a paper. That would be a really great opportunity.
That's awesome. Okay, so just kind of recant it back is one, approach hospitals, say that you're interested. Two, see if you can get hired on in somebody who's got the same kind of chops that you have in, say, the XR development space as in the medical space, whatever they have. They're a domain subject matter expert. Another one, find the innovation departments, work with them. Another one we're talking about is you go to something like, you know, PubMed and type in virtual reality and look for all the citations of use cases and say, okay, who are the cool people doing big stuff in here, and how can I find a way to find an alliance, whether I'm getting hired or doing a partnership, or what does that look like? And there's all a couple of ways to start to get in there to understand the language, to understand the domains, to connect with the subject matter experts, and to not go in blind, right? So that you can kind of work your way into that space. Is that kind of?
Yeah. And they're super interesting people in the field that are really knowledgeable about their expertise. One example is the Stratus Simulation Center, which, you know, I don't understand why VR hasn't focused on every single entity that has the word simulation in it, because it's a really expensive business. But they're magical. They are completely magical. They had a program to reduce the 10 most critical accidents that happen in a operating room. This was not done in VR. This was done with an expensive mock-up of an operating room,
Mm-hmm.
They had they had simulations of each of these 10 problems, 10 risks.
Yeah.
And they would bring in surgical teams that had 10 years of experience, and because their simulation was so good, and it wasn't so good from a virtual the level of lifelike the simulation was, but they were able to engage these teams and cause cognitive overload. And they filmed all of these encounters, and they would sit down with the team and explain where the problem happened and what the team could do to improve it. It's absolutely. I mean, they're complete magicians, and those are the people that are looking at AR and VR. There's another lab that is designing XR solutions for very long NASA space flights. 3-year long space flights.
Wow.
Where you have to have just-in-time medical education and also artificial intelligence to help diagnose those problems. And I've seen simulations of the space-based emergency treatments with both the Oculus and the Vive, which is fascinating. It's a 30-minute latency from Mars to Earth. So if
you better figure it out, yeah.
You gotta figure it out quick. And, yeah.
He's going down. Response: he's dead. It's like there's such a delay there, but you're right. There's huge needs there, and I think that's a really good point of looking at the medical simulations to see what are the real problems that you already face, and what are the super expensive solutions, and how do you make it cheaper, faster, better with VR or XR technologies. I think it's a beautiful use case. Stephen, I know you had to go because I know it's summertime in Boston, and you've got about 3 minutes of summertime over there, and I know it's a Friday, and I appreciate you taking the time to make this happen. This was kind of a last minute podcast that popped up, so I appreciate you being here. Is there anything else you'd like to let people know about before you tell them how to get a hold of you and what you're working on?
Yeah. So there's one thing I would want to say. I focused on very engineering oriented applications because that's my makeup, and it's. I'd like to say that I've been a recovering engineer for 30 years. But there's a company, Trip, with 2 Ps, that is doing amazing things with wellness in VR by having group sessions to meditate. And it's really possible that this is going to be the next approach to mental health. As compared to endless therapy or drug therapy, it'll be one more opportunity, and they're getting some real traction there. Mm-hmm. So interesting field. There's so many different domains to address, but yeah. From getting a hold of me, it's real easy. It's Stephen with a V at MedVR, medvr.io. Or you can go to our website, medvr.io. One thing I would like to say is we had the domain medxr.io, but we let it go because in dealing with all the clinicians, they thought that it was a radiology. We were focused on radiology, so we had to get rid of the XR and put the VR in because the recognition rate of VR is like 80% with clinicians.
That's so funny, man. And it's so interesting because depending on who you are and where you are in the space, it just there's certain nomenclatures and terminologies that it's just that's what it is. And instead of trying to change the idea of an entire industry, you're like, I'm just gonna change my name. It's fine. I'm just gonna switch it out. It's easier. It's so much easier. Cool, Stephen. Hey, so what's up?
And one other thing, we're restarting the talks that we've been giving. You can see the historical one on our website. The next one is on the 13th. You'll be able to find it on our website. If you email me, I'll make sure you get on the list to see it. It's a anesthesiology simulator built on an Epic grant, and it's really neat. And this is a very technically well-versed anesthesiology nurse, Peter Stello, who understands how Unreal works. So we'll have a combination of a discussion on the technical side of innovation, as well as the experience side of innovation, because he's been the anesthesiologist on the machine, checking to make sure that the patient is stable and changing the anesthesia procedure if it's not. And he also teaches at the University of Alabama nursing program. So it's pretty cool talk if you want to get into the nuts and bolts of it. Really interesting person.
That's awesome, man. So if you want to check out the talk with the anesthesiologist and learn both sides of the equation, both the technical and also the experiential, you can go to medvr.io, or you can hit up Stephen on his email. Stephen, thank you so much for coming on the show, brother. I appreciate you being here, man. It is always a pleasure, sir. Enjoy that Boston sunny weather.
Yeah, likewise. Enjoy LA. I miss LA.
Come back, man. Come on. Yeah, we'll get you, dude. I promise. No COVID, right? It'll just be good times and sunshine. That's what we got for you, brother.
Good times. Yeah, I should get out there.
All right, dude. Much love, man. I'll see you on the other side. Bye now.
I will. I definitely will.
Thank you for listening to the Heroes of Reality podcast. Check out heroesofreality.com for more episodes. While you're there, you can also take the Heroes quiz to find out what kind of hero you are. Or, if you have a great story and want to be on the podcast, tell us why your hero's journey will inspire others. Thank you for listening.